the gentleman from Ohio, Dr. Wenstrup, to inquire.
Well, thank you, Mr. Chairman. Thank you, Mr. Secretary. Pleasure to be with you today. Healthcare, I'm a physician. Healthcare is and should be a national priority. I'm encouraged to hear you talk about finding the origins of COVID, identifying that. I served on our Board of Health in Cincinnati, and you're exactly right. We can't address these types of issues if we don't get to the bottom. Going to the border quickly, when I visited there back in April, we saw many coming in with lice, scabies, meningitis, chickenpox, flu, and of course, COVID-19. And I think that this is a very serious concern that we have for the health of America when this is coming in. So I do want to work with you. I'm encouraged by your concern, but let's work towards a healthy, legal immigration policy that is best for everyone. Want to go next to drug pricing, and we need to address the cost of drugs in the United States. It's important for our patients, and I think there's bipartisan room here. And I believe that foreign price controls will not leave room for the next set of cures. And so we have that balance between innovation and then cost at the end of the day. Let's lead the world on both of those things. I know there's a lot of things we can work together on. I always talk about the health span of America. You just kind of touched on it there a little bit. We always take a look at lifespan, but what about the health span of Americans? Prevention and cures are often looked at as a cost, and that's on the short term, but we don't often look at what we save in the long term when we do this. And it sounds like you're on board with that. I do want you to be aware that we have a rural and underserved healthcare task force that the chairman put together, and it includes Representative Arrington, Sewell, Davis, and me. And I look forward to working with you to address the health disparities in these communities. And you sound eager to want to engage in those. So I appreciate that. Substance abuse, we can't ignore that. It's a problem. If you've read the book Dreamland, that's my district on the cover. If you haven't read it, I recommend it to your attention. I'm proud of the work we've done on surprise billing. Let's make sure it gets done right. And I will say this too, as a physician, there's no part of me that doesn't want Americans to have access to health care. That's obviously extremely important. We talk about Medicaid. I'm proud to live in a country that has a safety net like that is there for people so that we can maintain some health for those that have trouble affording it and for other reasons. But the statistics have showed that that particular plan has the highest mortality and morbidity of any in the country. And, I think we're better if we start to look at solutions to how fewer Americans need the Medicaid program, because the fewer that are on it, then the better it is for those that are still in it. That's more of that. We want more of the best care for more Americans. So I'd like to continue to work with you on those issues. So I threw out a lot there, but I really do look forward to working with you. And I'm asking you one question. Will you commit to work with Congress, and in particularly members of Congress that have medical backgrounds? We met many times, our Doctors Caucus, we met many times with Secretary Azar, and it was very productive, and I think we could probably do the same with you. And so I'm hoping that as you work through payment rules and other issues that impact our healthcare providers, and more so our patients, that you'd be able to spend some time with us as we've had boots on the ground, so to speak.
Congressman, you put a lot out there, but I certainly am looking forward to working with you and working with you from the vantage point of a physician. Your experiences are going to be immensely important and helpful to us. So absolutely look forward to working with you and your colleagues.
Thank you so much.
Thank the gentleman. Consistent with committee practice, we will now move to a